Safety Association recognized by WorkSafe BC and funded through contributions from construction employers. So they contribute to their WorkSafe BC premiums, and some of that goes towards funding the BC CSA, which has a mandate to develop services and resources to assist construction employers with doing what they need to do, basically, to keep workers safe. So an overview of my presentation today. First of all, I'm just going to do a bit of a background on occupational health hazards in the construction industry, and then after that, I'll talk about some of the projects that we've worked on and that we have available at the BC CSA. First of all, I'll talk about the silica control tool, which is kind of our flagship occupational hygiene program, and then a few other research projects that we've been working on, and then some other resources and programs. So this is a slide that I borrowed a few years ago from Hugh Davies. I think he saw it in another presentation, but it does resonate with me. It says, in the construction industry, we whisper health and shout safety, and that is, I think, traditionally the way it is in construction and probably in a lot of industries. You know, construction is a very hazardous industry from a safety perspective, so it makes sense that there's a lot of focus on that. And also it's made up mostly of small employers. So most construction companies don't have hygienists on staff. Even a lot of the bigger construction companies don't have hygienists on staff because it hasn't been as much of a focus historically because of the very serious safety hazards. But you know, construction companies are very used to talking about safety, dealing with safety concerns, making safety programs and plans. So I think that they're in a good position to take on more hygiene challenges and more hygiene related responsibilities. So there was a paper that came, or actually a couple of papers that came out probably about nearly 10 years ago now. It came from an analysis of the US Building Trades National Medical Screening Program, where they looked at the risks of occupational disease from a lifetime working in construction. They compared people who work in construction. They compared people who actually are in building trades to people who work for the same companies who are in more administrative or you know, more kind of administrative, scientific kind of roles where they're not expected to be working directly in construction. And they found that the people who do the construction trade jobs, they have a 2 to 6 times higher risk of developing an occupational disease of some sort over the course of their life. Construction trade workers, they had a 16% chance of developing chronic obstructive pulmonary disorder, an 11% chance of, or 11% of them had a pneumoconiosis of some kind, like silicosis or asbestosis or some kind of lung disease like that, and 73.8% got hearing loss. So the risks, the health risks of construction work are not trivial. The reason why the focus has been on safety is not because there are no health risks. There are many health risks in construction. Injuries, there are also safety hazards, of course, like 78% of people in the study had a lost time injury. There were 0.5% fatal accidents, fall fatalities, 0.2%. I think, yeah. So this is of the injuries. It's not 0.5% of people had fatal accidents. 0.5% of the injuries were fatal, and 0.2% were from falls. So with that in mind, this is my first poll question, and the question is, what is the leading cause of work-related death claims in BC? The first option is yeah. Okay, you guys can see the options here. There's motor vehicle incident, asbestos exposure, fall from height, or respirable crystalline silica exposure. I'll just leave this for, how long do you normally leave it for?
60 seconds.
Okay.
Or until 70% of the people participate.
Okay. Oh, well, we're almost
there.
Okay. All right. We've ended the poll. Okay. So yes, 56% of you got the right answer. The leading cause of work-related death claims in BC is asbestos exposure. Now, not all of this comes from the construction industry. There are other industries where asbestos exposure can occur, but a lot of it is in construction. And I mean, these are also historical exposures from the past, the people who have now developed disease, but it does highlight the health risks, because asbestos is still an issue in construction because it's still in a lot of buildings. Okay, so should I share the results? Or?
You can X out of that
Okay.
box in the upper right corner.
Okay. So in the WorkSafe BC, they have an occupational disease strategy, which kind of informs their inspection focus. They look at what the main risks are to workers, and they set a strategy for what they're really going to focus on in their inspections. So for this year, 2023, they're focusing on noise, welding fume, sensitizers, UV radiation, asbestos, and silica. And as you can see from these pictures, all of these hazards are present in construction. MSI, like musculoskeletal injuries, and lead are not on the list, but they are focuses of WorkSafe BC's, and they are major hazards, and both are also present in construction. Okay, so this comes from a study from UBC from several years ago that looked at mesothelioma. So this mesothelioma is a cancer of organ linings, particularly lung linings caused by asbestos. And they kind of compared the cases of mesothelioma that were compensated through workers' compensation. And then they looked also at medical records of who actually is being treated for mesothelioma in the healthcare system. And you can see the darker bars are the compensated cases, and the lighter bars are the diagnosed cases. So the lighter bars, that's all the cases that were identified in the healthcare system, and the darker bars are the ones that actually receive compensation from workers' compensation. So even though, even though this is the leading cause of death, we're not even catching all of them in the compensation system because, well, I have another slide that talks about why that might be. So why is there a gap between what is compensated and what is actually occurring? Part of it is because there is a long latency period for mesothelioma and many occupational diseases. So by the time you actually get sick, you may no longer be working. It might not be top of mind to go, and if you even realize that it's an occupational disease that you got it from work, you may not have the time or the interest in pursuing a workers' compensation claim. Also, people are reliant on physicians for both medical and compensation information. So the physician who diagnoses you, they may not know that you can apply for workers' compensation. They may not realize that it's an occupational disease. Perhaps this is less of the case for mesothelioma, but for many other occupational diseases, it takes, not all physicians can kind of, or have the experience to make the connection between the disease and the exposure that you received in work 20 years ago. And physicians many are unfamiliar with the workers' compensation system, so people don't always get the support that they need to go through the workers' compensation system. And they also did this analysis on silicosis and found a very similar trend. So they looked at, there were 52 cases that were identified through medical services data, 268 cases through hospitalization data, and 21 that were identified through workers' compensation. And there's a bit of overlap between these cases where they were in the same case showed up in different records, but you need to look around to find these cases, and it's basically the same reasons. And so my point here is that even though we know about a lot of occupational disease cases in construction from the workers' compensation records, that doesn't paint the full picture. So why do health efforts lag safety in construction? And this is probably similar for other industries as well. There was a report a few years ago from an AIHA working group on construction industry, and they put together a report called Focus 4 on Health, where they were trying to really boost the profile of health in the construction industry. And so they had to think about why this might be in, and this is their list that they came up with. And the first one is, seeing is believing. You don't, if you see somebody fall or get hit by something or some other kind of safety hazard, it's immediately obvious what's going on, but you may not always see that you're being exposed to something that is causing ill health. So, for example, I've got a picture here of different sizes of particles. This is what I use when I talk about respirable crystalline silica, which is with silica dust, it is the respirable fraction, which causes health effects, and that is very small particles. The PM 2.5, these are these red dots. PM 10 are these blue dots. The big gray thing is a human hair, and then it also has fine beach sand. And then the respirable fraction is kind of, somewhere in between the PM 10 and 2.5 range. So this is not visible to the human eye. And many of these kind of hazards are the same. So you can't see that you're being exposed. And then some people just kind of accept that this is just part of the job. There is, some people have the idea like, oh, well, I smoke and I this is just part of my life. I accept this risk. And there's the latency between exposure and disease also causes some of this. We've talked about that already. People don't, if they get sick when they're already retired, they don't necessarily realize that it was related to work. And sometimes the symptoms overlap with other illnesses. So for example, if somebody has nerve damage, it could be from solvent exposure, or it could be from medications they take, or it could be from an injury or MSI that they have. And sometimes it's hard to know where it actually came from. There are also some challenges if you're trying to do occupational hygiene work in the construction industry that I've come up against when I've been doing this, and it can be a difficult industry to work in, to do sampling in. I worked with Cheesy this summer on some sampling, and she found that you go to site and maybe the person that you're trying to meet up with, they're not actually there that day, they're at a different site, and things are moving quickly in construction. The work sites change rapidly. People are moving around between different sites. The tasks that people do can vary widely from day to day. So if you do sampling one day, it could be a completely different situation the next day. And most of the employers, 95% of BC employers have less than 10 employees. So they don't have occupational hygiene expertise on staff, most of them. In some cases, people have precarious employment. They don't necessarily stay with the same employer long term. There are language barriers in the industry. There's a lot of different languages that construction workers speak. And just a lack of available occupational hygiene experience and expertise within the industry. So with all that said, I'm going to talk about some of the projects that we've been working on at the BC CSA to try to assist industry. This is my second poll question, which is, where can silica be found at construction work sites? Concrete, asphalt, rock, ceramic tiles, or all of the above?
They have the option to select.
Okay, they can select multiple. Okay.
Those are our results.
Okay, so we got the results. So yeah, you guys are right, most of you here. Silica is found in all of these materials. Silica, it's a naturally occurring mineral, so it naturally is in many of the materials that are used in construction, just because it is found in the earth. I think it's the second most common mineral in the earth's crust, so it's something that we can't really get rid of easily in the construction industry. We can't phase it out the way that we are trying to with asbestos, but so it's something that we're going to have to keep working with and around. But it is very hazardous. It causes silicosis, which is a lung scarring disease. It causes lung cancer. It can cause heart problems. It is a very hazardous material with a very low occupational exposure limit. So the way that I got involved in the construction industry in the first place was to try to help them to come up with a tool to manage silica at construction work sites. Given all the challenges that we know about doing occupational hygiene in the construction industry, it was the industry thought that they needed something that they could use, like maybe something online or some kind of document that they could go and check what their exposure level is likely to be without having to do sampling every time they move to a different site, because that's very burdensome. So what we came up with was the silica control tool, which is available online. And the idea is to help employers to use existing data. So there is data out there on the expected silica exposure levels associated with different construction tasks. And we wanted to put something together to help get that into the hands of the employers in a way that would be meaningful and accessible to them. The idea is also to make a resource to educate employers and workers about silica, the hazards, what the health effects are, how to control it, best practices, and to help employers to produce effective and evidence-based exposure control plans to reduce the effort and the cost associated with doing so. Because if you have to pay thousands of dollars every time that you move to a new work site to make a new exposure control plan, then people are not going to do it. And to also improve the quality of exposure data that's used in risk assessment. So we tried to centralize a database of silica exposure measurements so that we could do quality control to make sure that what people are using in their risk assessment is good quality occupational hygiene data. In the Occupational Health and Safety Regulation from WorkSafe BC, in the section on the substance-specific requirements for silica, there is a clause that says that you don't necessarily need to monitor exposure for every work activity if you have objective air monitoring data that was collected during equivalent work operations through industry surveys or peer-reviewed or scientific studies. So if you have data from the same work activity, you can use that to make conclusions about what might be effective in what you're planning to do. And I think they have another clause similar for lead and maybe some other places, but this is in the silica section. So we kind of use that to work around, to build something so that people can make conclusions and decisions about how to manage silica. We started off, we have a construction respirable crystalline silica database. There are about 5,000 personal respirable crystalline silica exposure measurements in the database. Many of them come from the United States, some come from different parts of Canada, some come from Europe. They came really from the base of it came from the peer-reviewed literature and gray literature, like government databases and some industry reports. We also phoned around asking different Canadian companies and government if they had data that they could share. And also we've done some of our own monitoring, the BCCSA and UBC and some of our partners since 2015. We've been doing monitoring at construction work sites to try to build up this database of silica exposure measurements. For the quality control, it is restricted to personal samples only. They have to do chemical analysis for respirable crystalline silica. So you could do a dust measurement, but that would not make it into our database because it doesn't actually analyze silica. We only accept data that uses standardized sampling and analytical methods. If it's a method that we don't know about, or if you made up your own method, it needs to be a standardized one that's acceptable to WorkSafe BC. And we also only accept data that uses occupational hygiene best practices during sample collection, like flow rate checking and use of blanks and that sort of thing. So that's what this tool is based around. It's based around this database that is still being updated as new data comes in. And then we use that to build a model from the database. It's a linear regression model to estimate the exposure level for different scenarios. So in the model, the variables that are in there, we have the work task, which includes like the tool and the material, that's in there as well, and the controls that are used, what industry sector you're in, if you're indoors or outdoors, what region you're in, because we do have data from all different regions of the world. So it'll adjust. If you're in BC, it'll give you a different measurement than if you're in Ontario. And then the model, it estimates the exposure level, and what it presents to the user is the 95th percentile of the confidence interval around the mean. So it's to the user, it presents a conservative estimate of exposure that they can use in their risk assessment. And then because the OEL for silica it's an 8-hour OEL, it's 0.025 milligrams per cubic meter for 8 hours of exposure. Whatever estimate the model comes up with, we just present it. We just compare it directly to that OEL. Even though they might be doing a shorter task than 8 hours, and that's partly because silica, because it's a carcinogen, it's an ALARA substance, so employers are expected to keep the exposure levels as low as reasonably achievable. I'm just going to show you a few screenshots of the silica control tool so you can see what it looks like. So when you log in, another thing I should say is this is available to all employers in British Columbia. Anybody with a WorkSafe BC ID can get an account to the silica control tool, and it's soon going to be available in Ontario as well. I think in November it'll be available in Ontario. So it guides you through this process where you give it the tool information about what work you're doing. It gives you an exposure estimate, and then you select controls that you're planning to use. It updates the exposure estimate, and then it documents everything and creates a kind of a written plan. So this is a screenshot of one of the drop-down pages where you can select information about what work you're doing. So in this case, they're going to be working inside, and they're doing a work activity duration of 4 to 8 hours. And then with that information, I skipped over this part, but the task that I selected was drilling concrete with an electric hammer drill. The exposure estimate for this is presented on this dial. It's 0.066 milligrams per cubic meter. That comes from the model. And on the dial, you see it's in the red zone, so they're over the OEL, so they need to do more work to control the exposure. This is a hazardous level. And so then it kind of guides you through the hierarchy of controls, where you have to first consider, can I eliminate this task? Can I use engineering controls? What administrative controls can I use? And if I use all of those, do I still need PPE? So here are some of the engineering controls that are available for this activity. You can select a water spray system where there's a water spray attached to the tool, or you can select an LEV system, local exhaust ventilation, that's attached to the tool. I should point out that one of the limitations of this tool is that we can only estimate exposure where we have data. So not every activity that people might want to do is in the tool, and not every control that is possible is in the tool. And for that reason, we're still doing sampling to try to add. So if any of you are ever using this tool and you see that, the control I want to use is not here, it's not because you shouldn't use that control or we don't know about it. It's just because we don't have data. And so in those cases, we really appreciate it, and people let us know, and maybe let us come and do sampling at your site so that we can collect the data and put it into the tool. So with the controls that we selected, which I think we selected LEV for this situation, it reduces the exposure to 0.03 milligrams per cubic meter. So it's a reduction in exposure of 120%, but it's still above the OEL because the OEL for silica is very low. So we still need respirators. And so then the tool will then tell you, okay, with this exposure level, you still need respiratory protection with a protection factor of 10. And it gives an example of what might be suitable in that situation. And then that's the end. It takes everything that you've selected and it prints it out onto a document that you can use going forward. And then if you want to change things, there are places you can link and change. And one of the things that I encourage people to do who are using the silica tool is to try out different controls and see if you get a different exposure level. Try out different scenarios, and you will get a different exposure level. And so it kind of that is part of the educational piece of it, I guess, as well, so that you can see how effective different controls are. So in conclusion, about with silica control tool, it can only create exposure control plans when we have data. It relies on industry participation, so we do rely on construction companies to tell us when they need things added to the tool and to let us come and do sampling at their sites to get the data. We are doing continual data collection, and the tool is updated in response to new data that comes in. Employers are expected to use the tool appropriately. You have to actually do the controls that you say you're going to do. You have to follow all the best practices. A lot of information about that is embedded within the tool, and so the idea is that if an employer, just because they are using the tool, it doesn't mean that they're automatically compliant. They have to actually be using it properly. And the company, they have to take ownership of their own plan. You can't just print off a plan from the silica exposure, the silica control tool, and that's the end of it. You have to really, review it annually and be thinking about ways to make it better. Maybe you need to add some more site-specific information to your plan if it's not something that we have in the tool. So it's not the end of everything you need to do related to silica control tool, but it's intended to help construction employers to get most of the way there. Okay, so now I'm going to switch gear to a study that we did with Shalinda Shafee, who was a student here. She graduated in 2020. This was her master's project, and she did a project funded by the BCCSA, where she investigated factors that affect vacuum efficiency. So this is one of the main controls that are used to control silica exposure at construction work sites is local exhaust ventilation vacuums that are attached to tools. So Shalinda, she went around and measured vacuum flow rates at construction work sites in British Columbia and recorded information about the vacuum characteristics, vacuum maintenance procedures, and work conditions at the sites. And she also did some laboratory simulations to look at vacuum functionality. And what she found was that most vacuums that she found at construction work sites in BC were operating at only 26 to 50% of design airflow. So the manufacturer of the vacuum, they will, when they sell a vacuum, they say, okay, this is the flow rate that you can expect with this vacuum. But these vacuums were most of them were well under half of the flow rate that perhaps the employer thought they were getting. And so why was this? Well, proper maintenance and cleaning of the vacuums made a big difference. The better your maintenance and cleaning processes were, the higher the airflow in the vacuum. So Shalinda did some data analysis and found that frequent servicing of vacuums and changing the filters regularly had a positive effect on airflow. So if you did a good job of that, you had a better airflow. Negative effects on airflow were knocking filters. Sometimes people they will clean off a filter by just knocking it against something to shake the dust off, and that damages the filters, and it is bad for flow rate. Some people are doing their DIY repairs and customizations on their shrouds and their vacuums. That is also not good for airflow. And older vacuums, so vacuums, they need to be replaced fairly regularly because they lose their suction as time goes on. So even after 6 months, vacuums were not functioning as effectively as they were when they were new. But one positive outcome was that workers generally were receptive to using vacuums. They didn't find it to be an impediment to their work. They were the workers that were interviewed in this study. Generally, they wanted to protect themselves. They wanted to protect their colleagues. This is another study that I published recently, where it's basically based on some of the exposure monitoring that we've done to support the silica control tool to collect data. We did an analysis looking at data collected about, I think it was around 300 measurements collected at construction work sites in BC, Alberta, and Manitoba since 2015. And then I also compared that to an analysis of a database of task-based silica exposure measurements from construction work sites that were reported in literature. So what I found when I looked at the data was I compared work sites that were using local exhaust ventilation to work sites that were not using local exhaust ventilation, work sites that were using wetting to work sites that were not using wetting, etc. And what I found was that there was about a 43% reduction in exposure for the work sites where they were using local exhaust ventilation. And this is controlling for task and all these kind of things. And there was a 53% reduction in exposure when they're using wetting. And for some reason, when you use both, there was only a 33% reduction. I'm not really sure why that is. But the point is, in this other analysis of silica exposure measurements from work sites in other, I think many of them are in the United States or other parts of the world, they saw higher reductions. Basically, they saw a 69% reduction associated with local exhaust ventilation and a 71% reduction in wetting. So the message here for me is that it's great that we're using controls, but maybe we need to do a better job on making sure that the controls are functioning effectively and are being used to their full capacity, because we're not getting, from the data that I have, we're not getting as much exposure reduction as we would like to in Western Canada. Okay, so this is my last poll question. Okay, lead is no longer used in paints or glazes. True or false? Okay, it's false. Lead is heavily restricted in paints, and is I think it would be very unlikely that you would find a new building that has a lead-based paint used, but it is still used in glazes that are on ceramic tiles, so lead can still be found in homes, in buildings in British Columbia. So this leads me into another study that I'm working on right now, where we're trying to do a health risk assessment for ceramic tiles, because industry, especially industries where they do renovations or demolitions, the workers can be exposed to lead when they're around ceramic tiles. And ceramic tiles, they also contain silica, so you could be exposed to both lead and silica. The dust can be generated when you're removing or disturbing ceramic tiles, and employers, they need to produce exposure control plans for work with designated substances, which lead and silica are both designated substances. So this is a project where the work is ongoing, so I don't have any results to present, but I just wanted to let you know this is something we're working on. I teamed up with OEH. I think a lot of you know Robin. This is her company, and the University of Northern British Columbia. They've got a lab that they do occupational hygiene method development. So we teamed up with them to try to address this issue for industry, because the problem is we know that there is lead in the glazes for many of these ceramic tiles, but we don't actually have a good way of measuring exposure to lead when people are working with ceramic tiles. This is a lab report. So if you submit samples that come from ceramic tiles, you can use there are lead and paint methods that you can use to do the analysis, but the labs, they have very low confidence in using these methods if there is ceramic present, because the ceramic, it's a refractory material and it interferes with the method. It's difficult to digest in chemical analysis, and so in this report here, there's like a little note down at the bottom that says ceramic tiles are not included under the lead-based paint definitions. Analysis of ceramic tiles using lead-based paint protocol is not recommended. But there isn't really a method that is recommended for ceramic tiles. So this is an industry this is a problem the industry kind of approached me with, that they're struggling with. They want to know if people are being exposed. They want to know if they're controlling it correctly, but they don't have a good way of measuring it. So we had two questions in our research project. Is, can we find a method? Can we validate? Is there an existing method out there that we can validate that actually works for ceramic tiles? Can we validate that? Or if not, could we possibly look at silica instead as a kind of indicator of exposure? Because we know that the exposure limit for silica, for respirable crystalline silica, is lower than the exposure limit for lead. So if we are controlling silica, are we also controlling lead adequately? Could we just measure silica instead of lead, basically? So these are are two questions that we're trying to answer. So we've been doing sampling this summer. We've been doing a bunch of sampling of common demolition and cutting tasks at construction workplaces around BC. We're collecting bulk samples of ceramic tiles, personal samples of lead in air, and personal samples of respirable crystalline silica in air. And then these are getting submitted to the lab at UMBC, where they're testing some existing methods with the bulk samples to see if they are working. Basically, they'll get they crush up the ceramic tile, and then they spike it with a known amount of lead. And then they reform the tile, and then try and do the analysis and see what their recoveries are. And the plan is to select a robust and validated method and then use that for the analysis of the personal samples that we're collecting for lead, so that then we can both find a method, hopefully, that works for ceramic tiles, and also get some data on what kinds of exposure levels people have been experiencing doing this work in British Columbia, that we can then report back to industry to provide them some guidance on what to do in these situations. So this is just the last thing that I'm going to share with you. This is just a list of some of the other resources and programs that we have at the BCCSA that are related to occupational hygiene and health. As some of you probably know, WorkSafe BC, in January 1st, they will require anybody who is working in asbestos abatement work or anything where they could be exposed to asbestos to have asbestos certification and licensing. So you need to actually be certified to work around asbestos to make sure that you know what you're doing for the moderate and high risk protocols. So at the BCCSA, we have developed a training program basically to certify people. So that's one of the things I've been working on. We also have a bunch of exposure control plan guides that we started out developing these for what's called, it's the restoration industry. So basically they're the people who come in if there is a fire or a flood or some kind of disaster that requires really an emergency response. They come in and do the cleanup basically, and that's a very hazardous material because you have to. That's a very hazardous job because you have to come in not really knowing what you're going to find, and you have to do it quickly because it is an emergency and there are a lot of potential hazards. So we put together these exposure control plan guides to help them to anticipate what they might encounter, and to know what they should do in that scenario, so that the information is all ready to kind of just select for the situation that you find yourself in. So we've put some together for lead, mold, elemental mercury, polychlorinated biphenyls, sanitary sewage. I also did one, this one was not for the restoration industry, this is just for anybody. I did one on wildfire smoke, just to give people a guide to what they should be thinking about if they're developing an exposure control plan for wildfire smoke. So I just highlight these because they're on our website, these exposure control plan guides, and they have information on some of these hazards that could be, that they're just resources that could be useful and can point you in the direction of other resources or where to get more information. We've also hosted a few webinars for industry. One was on isocyanate exposure. So these are materials that are applied. The one we've looked at ones, they're spray foams or membranes that are applied and they harden, and then they're very useful products, but they contain isocyanates, which are sensitizers. So we did a webinar on that. And we also did one earlier this year on just exposure control plans and what they are and when you need one. And that was actually our most attended webinar, I think, that we've had at the BCCSA, and because I think this is a topic that people are interested in, they want to do their best, they want to learn more, so that's encouraging for me. And thank you. That's everything I have to say.